the spine. Get the messages flowing through the messages. Through the nerves.
Okay, and when do we start getting our spine realigned? Anybody know? When do we start getting our spine? When? When we're injured? Okay. What does this 2 words say? Right. Do you notice all these pregnant women up here? You see them all? They're all lined up right here. And the reason why they're all lined up and they're all pregnant is because they're all under care, and they're not coming in for any other reason other than they want to be connected to the source, right? Where does all healing come from? Does anybody know? The Lord is the source of healing, and He gives us the life. He gives it and He takes it. And He puts the life force in an area called the central nervous system. So when we're like many, probably 20 dozen pregnant women I've worked on in the last 28 years. The reason why they come in, and the reason why these women that are pregnant, the reason why they get their baby spines checked at birth is because they're interested in removing the interference to that life impulse. Okay? So I appreciate your guess. Thank you for that. I started going to a chiropractor in 1963. We delivered our 6 kids at home. They've never been inoculated. They've never been vaccinated. They've never had a pill. They've never had an antibiotic. They never had a cough syrup. Why? Because we know an awesome God. A God who saves, a God who heals, a God who delivers, a God who redeems. And we know that if we can stay in alignment with our awesome God, if we can stay in alignment with that, yes, we all have interferences in our life, issues in our life, but if we can stay in alignment from above down, inside out, the body is in a healing, balanced system, and it knows how to re-regulate, regenerate, and recreate its own living tissue. So, for example, if I was to look at my epidermis, which is my skin, my body's creating new epidermis about every 2 to 3 days. I have totally new skin. That's how I'm created. You have new lung tissue every 90 to 100 days. You have a new heart tissue every 120 to 104 days. You have a new lining of your stomach every 24 hours. Why is that? Because that's how we're created. Scripture says that we are fearfully and wonderfully made. Marvelous are His works, that are our soul, our mind, our intellect. We know in the spirit that we're created amazingly. I know that if you were to nick, I don't know if you shave your legs or not, I know you don't, but if you shave your legs and you nick your legs, what happens? You bleed. Then what happens? You clot. Called a what? A scab. You get a scab. Why do we get scabs? And this is the thing. The scabs that we notice on the outside are occurring in the inside. In the liver, in the pancreas, in the thyroid, in the prostate, in the male sex organs, in the ovaries, in the uterus. It's forming within our lung tissue, and our heart tissue, and the coronary arteries. In fact, does anybody here right now sense that their coronary arteries are clogging? In fact, I'll use the F word, which I normally don't use. Can anybody here right now feel their coronary arteries clogging? Yes or no? No. Can anybody here right now tell me if they're going to have a stroke within the next 30 minutes? Can you sense that? No. What's the symptom of a heart attack? Bam!
I don't know what you said, Frank.
When you hit the floor. See, so we don't base our health on how we, starts with an F, how we feel, but that's the system. And that system is called the mechanistic system. So if you're taking notes, mechanistic means I'm a mechanic, you're a machine, abuse your body as much as you want, and when you get to failure, John, I know you're praying for me, thank you. He's a spiritual guy, he's very holy. But when you get to failure, hear me clearly, I want you to get this. When you get to failure, what does the system teach you to do when you get to failure? Okay, it's a very smart system. When you get to failure, the system says to you, mask it, cover it up, make a smoke screen. It doesn't line up with the scripture that I know of. I think I'm supposed to be aware of my body, aware of how my temple is, aware that the Spirit of God dwells within me as a believer. I'm supposed to be what? Aware. And then I'm supposed to listen, and then I'm supposed to adjust, a little chiropractic terminology. Then I'm supposed to adjust my life to what's happening in my life. If I don't adjust my life to getting to the root of the cause or the basic fundamental underlying reason why my wife has allergies, why my kid gets ear infections, why I got this thing in my back going down my legs into my feet, why my hands are numb, why my blood pressure is high. Do you know why your blood pressure is high? Your blood pressure is high because God is trying to keep you alive. So for every 1 pound of fat that I have on my torso, my body, my mesodorphic body, because I'm a mesodorph. You're an ectodorph, you're an endodorph. For every 1 pound of weight, my body innately creates 6,000 to 8,000 more miles of capillaries. Let me repeat. For every 1 pound of overweight from my normality, innately God, the designer of my body, creates 6,000 to 8,000 more miles of capillaries. So if I'm 10 pounds over my normal weight, what does my body create? 60 to 80,000 miles of capillaries. What does that do to my heart? What should my heart do to get blood to that area? What should it do to the pressure? Should it decrease it or increase it? Thank you, doctor. But I have an idea, because you have disease insurance and you have sickness insurance and you have crisis insurance. We get to shop at Walgreens for free. We get to go there, take a beta blocker. My body has one goal: to stay alive. You understand that? Okay? And so the body's struggling to stay alive. I go to Walgreens for free because I have sickness insurance. When do you use your health insurance anyway? When you're sick. So we should call it what? When do you use when do you use life insurance? Anybody know when to use life insurance? When you die. I mean, it's funny, but I mean, it's the system that takes your thought life and it plays games with you and your family. Every one of my home births, my kids could have died. And every one of them was an amazing expression of the power of an almighty God. But we don't, you know, we say we have faith, but we don't have faith. We say we walk by faith, but we don't. We walk by sight. I'm telling you right now, man, you are created to heal. Healing is normal and losing your health is abnormal. But we have to start thinking outside of this box. And so if you force your blood pressure that is increasing to keep you alive, if you shove it down with a chemical, a petrochemical, that's why side effects of high blood pressure is heart attack. Did you know that? That's one of the side effects, is heart attacks from high blood pressure medication. Did you know that? I talked to a professional soccer trainer today, and she said her mother died from Lipitor poisoning. You know what Lipitor is? It's a statin. You know what they give statins to people if they have high cholesterol? Why does Florida Hospital pass an internal memo 2 years ago saying no more prescriptions of Lipitor or Crestor? Does Florida Hospital know how to bill hospitals? Yes. Does Florida Hospital know how to put Jack in the Box central cares on every corner? Yes. Am I saying they're all bad and they're all doing? No, not at all. What I'm saying is their model we have to be guarded about. And the model is this: don't take care of yourself. When you hit failure, no, no, no. I didn't say that. I didn't say when you hit failure. I said when you notice that you hit failure. When you notice it. The Lord blesses us with a notification, and what do? We shoot ourselves in the foot. God blesses you with the tingling. God blesses you with the migraine. God blesses you with a tumor, a cyst, a mass. But what do we teach in our culture? Because Angelique Jolie says, oh, I may have a genetic gene, and it may cause cancer in my breast. So what am I going to do as a type of model of wellness and vitalism? What is she going to do? I'm going to remove my breast. Why? Because my sickness insurance will pay for it. Any questions? So for those of you here today that would like more life, that's why I'm here. I'm here to hang out all night tonight. You want to go home, get your family, bring them back, we'll just stay here and keep working on you all night. But the point is this: if you have interference to the life force, you're going to be in trouble. Now, we've had an organic farm for 15 years. We've had chickens and beehives, and this is how it works. If my kid chases down, my 5-year-old daughter chases down a hen, and my 7-year-old daughter grabs the brainstem, and she snaps the chicken's brainstem, what happens to the chicken? Sopa de pollo. Now we're going to, right? Yo tengo hambre. So, but if she doesn't snap the brainstem of the chicken, and she slides her hand down these vertebrae, and she snaps this vertebra, what doesn't happen to the chicken? It doesn't die, but something does happen. There's a consequence to pressure on the spine. What's going to happen to that chicken? The P word, very good. It's going to be what? Paralyzed. So now listen to this. If this is the nerve that leaves your neck, in the lower neck, and it goes down your neck muscles, your arms, your shoulders, your hands. If it's that nerve root complex that goes to your thyroid gland, if the thyroid gland doesn't get the impulse of what? L-I-F-E. Doesn't get the impulse of life from where? From the brain. And if it doesn't get to the thyroid, does the thyroid have an effect? Yes? Okay, yes? Yes? Okay, if it doesn't get the impulse, does it have an effect? And everyone's saying, yes. What happens to the thyroid? Does it expand, or does it atrophy and get weaker? It atrophies and get weaker. How do you know your thyroid gland is about to fail? How do you know your prostate gland is about to fail? How do you know your ovaries are about to fail? How do you know your uterus is about to fail? How do you know your pituitary is about to fail? Or your pancreas? You never know. Never will you ever know until you know. And then when you know, well, now you know because now you're in it. How could that be called health care? It's called sickness care. Back to the thyroid. Here's the thyroid. Here's the nerve impulse. The thyroid atrophies and atrophies and atrophies until eventually we go ahead and we give you thyroxine, or once we give you thyroxine, we shut down the. Once we give you insulin, we shut down the. Once we give you beta blockers, we shut down the. Once we give you OxyContin, we shut down the. Yeah, you see, we're falsifying your body, your spouse, your daughter, your wife, your kids, your son. We're playing games with. This is called Russian roulette. Have you ever heard of drugs that have side effects? Honestly, anybody here? No, really. Have you heard about that? There's no such thing as side effects, man. Look, if I asked the Debbie, go into the closet and bring out a little half a gallon of Clorox, and we take out our little cups, and we put, everybody gets 4 ounces of Clorox tonight as a part of the gift from Dr. John. And so everyone has a little cup of Clorox, and we drink it. Is there going to be an effect or a side effect? There's an effect. You drink Clorox, you have an effect. You take a poison, you have an effect. The question is, are you willing to give up your family's life force and your family's life and the future of your spouse and your kids and your parents? Hospitals are banking on what I teach you tonight. Will go in one ear and out the other, and you'll say, I knew it anyway, and you'll wait till your kids get sick, and then you'll bring them in. And that's okay. That's not what we do, though. What we do is we remove the interference, and we allow God to do the healing. Any questions? So, here's the cord. Here, inside of your neck is this thing right here. What's this thing called? The brainstem. In the chicken, or in Dale Earnhardt, the race car driver. If his car hits the wall and his head hyperextends back and the bone goes into the spinal cord, what happens to the race car driver? He dies. Or, some of them do become paralyzed. By the way, Christopher Reeves, when he's being interviewed, he was paralyzed from his brainstem down. And when he was being interviewed by Larry King, as Larry and both of them were getting these watery eyes because they were getting emotional in their conversation. And this guy is living on total machines. His heart, his lungs, his spleen, his bladder, his bowel movement, his colon. And Larry asked him, what's the one thing you would want that you can't have? What's the one thing, Chris, that you're missing since your accident, your horse accident? And he said, I would love to feel pain again. You see, pain is a blessing. You see, noticing what goes on with your body is a blessing. But the world turns it into this weird thing, man. Look it. Why? Who brushes their teeth when they're only in pain? Anybody here? If you do, you're going to have trouble. I had my third molar pulled 3 summers ago without anesthesia. You don't want. It was not fun. It was struggling for me. But pain is a blessing. Look, 15 years ago, I was paralyzed for 27 days on January 1st, 2000. Couldn't move my legs, couldn't move my arms at one point. There's a message in there for me. There's a message in it for all of us. But we don't want to know. We want to just get out of our situation. So, again, as a recap, you can't go to bed like this and wake up tomorrow morning like, can you? Can you? No. Why? What does it take to get from here to there? It takes time, doesn't it? It's a process, isn't it? And for some of you tonight, you're going to look at your analysis with me and you're going to go, holy health, Batman. What have I been doing to myself? I've been living my life based on the absence of something versus the presence of something. So if I was to ask you one of the most basic questions I could ask you tonight as we're getting ready to move forward here quickly, what is health? Is that a fair basic question? If someone was to say to you, hey, Carlito, ¿qué pasó? Mira, what is health? Could you answer that question? Could you answer the basic question of all life? It's like saying, Dr. John, what is food? I mean, look, if you can't answer the question, what is health, Carlos? If you can't, Carl, answer the question, what is health? Then you will never know where to find it. You will never know and how to achieve it and retrieve it if you don't know what it is. You people think, are you in the medical, are you a doctor?
No.
What do you do? You're a nurse. So it would be a fair question for you, right, as a nurse. LPN? RN. Good to have you here. So it's a fair question, right? It's a fair question. Are you ready?
Okay.
Okay. What is health?
The feeling of well-being.
You went right back into the F word. I just went over the F word for 12 minutes. It's not feeling of nothing. Wait a second. Wait a second. Can you explain to me, and this is not to put you on the spot, listen to yourself. It's a feeling of, do you hear what she said? What does well-being feel like? Didn't I just say that our bodies are decaying and degenerating unbeknownst to us? Did you hear me say that about the coronary arteries? Yeah. When do we know we're having a coronary artery situation? Bam! Sweetheart, Dr. John, can you get off the floor? I wanted to get an adjustment tonight. Can you please get up, please? Dr. John is fluttering on the floor. There's stuff coming out of his mouth. It's white stuff. I think he's dying. Do you understand? Okay. Health has nothing to do with the absence of anything. Many people were teaching it in medical school and even chiropractic universities that health is defined as the absence of disease. Disease is always absent until it's present. Well, wait, you mean to tell me there's a paradigm here? There's a shifting. There's a beginning and an end of this? You mean health is not the absence of disease? Of course not. Health is the presence of something. Jack LaLanne said it best. He died at 97 years old, one of the most famous chiropractors, trained 2 hours a day in his 90s up until his day before he passed away. And Jack LaLanne said this, and this guy was a crazy nut. He was a exercise guy on TV back in the 70s and the 80s. And he said, in the United States of America, we teach people how to work at dying instead of teaching people how to work at living. And I got 10 minutes left to explain this to you guys. I don't know if I can get it done. I'll try. When Solomon said, or ever the silver cord will be loosed, or the golden bowl will be broken, Solomon said this. And then so here it is. Solomon's talking about life in the nervous system. If I shoot a bullet in your brain, what happens to you? Anybody want to take a guess? Okay, if I take anyone's spinal cord here today, let's say you don't believe the thing I said so far, and I take your spine and I just break it. What happens at the break? Interference of what? Of the life force. Yes? Are you sure? So if life is in the spine, then shall the dust return to the earth as it was, and the spirit will return to God who gave it. Life is the nervous system. The Bible says that life is in the blood. But healing is in the central neurological system. That's how you heal. You cannot heal without the life impulse. Any questions about that? Make sure we're clear, because we're moving fast. So when the head tilts, the first vertebra weighs 4 ounces. The first vertebra tilts up against the brainstem, and what does it cause? Starts with an I. Interference. Interference of what? Starts with an L. The life force. So watch. Do you see the head tilt? Okay, what's happening to this 14-year-old's shoulders? Compensation. What's happening to the hips? What does this say? Now the messages of the life force are distorted. Is there a consequence? And we all going to say? Yes. Yes, there's a consequence. Do you notice it in your child when it's 6 months old? Do you notice it when your child has just been diagnosed with sudden infant death syndrome and died in that crib? Is that when you notice it? Do you notice it when your kid gets an ear infection on the right, then it's on the left, then it's on the right, then it's on the left, then it's swollen glands, then it's a fever, then the fever goes away, then it's numbness and tingling, then the child's an asthmatic, then the child has allergies. Where do you think this comes from? Thou shalt have allergies when thou hits 12. Thou shalt have breast cancer when thou hits 29. But you guys are conditioned to have this weird value system. Granted, I cut off my foot, have somebody sew it back on. But if you sew my foot back on, who does the healing? God does the healing. He created us to heal. Does the surgeon do the healing, yes or no? No. Absolutely not. So the goal of me caring for your family's health is to restore and maintain function. That is the goal of your physician. To restore and maintain, or vitalistically speaking, my goal is to keep you from ever going through what that poor young man's going through in the back of the room right now. Right? 1 minute it's that. Those organs that are affecting his lower back and his legs are the same nerves that control his prostate. Do you think he cares? Does anybody here really care about an organ until they notice it's failed? No, because that's the way you're trained. So a subluxation means the bone is out of place, causing interference of the, and there will be a consequence to the interference whether you notice it today or 5 years from now. So if the impulses leave the spine and they're innervated to an area, and the area of your child, the blood vessels of the eyes, of the ears, the muscles of the diaphragm, the neck, the shoulders, the thyroid, the heart, the lungs, the larynx, the trachea, the gallbladder. Does anybody know anybody who's had a gallbladder removed? Really? Does anybody know anybody here who's a diabetic or a pre-diabetic? How about a pre-pre-diabetic? How about a pre-pre-pre-diabetic? How about a pre-cholesterolized guy? How about a pre-high blood pressure person? Everybody's pre until they're in it. And you know what's going to help you get in it? The American Pharmaceutical Association. Do you understand that if there was no drugs, there would be very limited surgery other than crisis care surgery? So if the impulses don't make it to the reproductive organs, what could happen to that woman or that man? Anybody want to just take a shot? Any age, your age. How about lack of ability to have a child? So a man says we're going to stick a 12-inch needle through her umbilical area, we're going to play games with her body, we're going to make her get pregnant? That's like saying I have a sinus infection and I'm going to shove 2 giant Q-tips up my nasal cavity so it doesn't come out. I mean, if the stuff is coming out, it's coming out for a... I had a guy here tonight, he says, Dr. John, look at my arms and my legs, I'm full of rashes. I said, amen. He said, what do you mean, amen? I said, something's trying to get... I'm coughing, something's trying to get... I have a high fever. I'm sorry, did he say he's having a high fever? He said that. Is a high fever healthy or unhealthy? Oh, I'm glad you're here tonight. Is a fever unhealthy or healthy? It's the body what? Doing its thing for what purpose? To keep you alive. So this is what health is. Health is the ability that you have to effectively adapt to the emotional stress, the physical stress, the environmental stress, the spiritual warfare. The ability that I have to what, Dr. John? Is that an evolutionized word? Adaptability? No. Your nervous system could adapt to a certain amount of stuff until one day what happens to your nervous system? It breaks, and then the organs shut down. Why does a woman take 3 little boys and put them in the back of an SUV in Montana and drive them into a lake and drown her 3 boys? Why does she do that? Because her central nervous system had it. She was done. Her mind was done. Her nervous system was done. She was done. And she kills her children. Those kids up in Columbine that were murdering kids, those kids over there at Sandy Hook, all of them were on antidepressants. Did you know that? It's a great study, man, if you want to study how many deaths in this country in the last 25 years in schools, how many of them were on antidepressants. The study I read was 100%. Who's the cure? Where do we get the cure for our depression? Where do we get the cure for anything? I go to the King. I go to the Lord. Every time. Every time. You see this right here? If that bone is out of place and this person is getting headaches and migraines and dizziness, they're getting it for a reason. You may know somebody that gets headaches. You may know somebody that has a numbness in arms, tingling in the arms, asthma, high blood pressure, low blood pressure, middle back pain, congestion, bronchitis, pneumonia, stomach troubles. Anybody know anybody with a digestive issue? Anybody here ever get a nervous stomach or digestive issues? Anybody here? 1 person, 2, 3, 4, 5? Okay. So what do? We shop at CVS for free because I have disease insurance. And I take something. You know the number 2 cause of cancer death in the United States of America right now is colon cancer. Did you know out of 41 industrialized countries, according to the World Health Organization, we are 37th in the world. We're the most toxic, one of the most ugliest countries when it comes to health care because it's not health care. It's disease care or sickness care. That's what we do here, man. Look at many people you take care of on a daily basis that could have changed their style of life and never made it into your presence as an RN. But we've got to think outside the system. It's called vitalism, not mechanistic care. The guy on the left gets hit. What happens to him? He Yes, you had your hand raised first.
Oh yeah, injury, subluxation. Yeah.
Good girl. Good girl. And you know what happened to him? He died. What happened to the guy on the right? Paralyzed. It's both death. One is more permanent than the other. Remember what I said about scabbing on the internal organs of your body, guys? Before you see the scab is there because it's happening at a cellular level. All right. Now, does anybody care about micro-trauma for their kids or their spouses or their family? No, it's micro, who cares? You know this thing with texting? It's a new disease category now. The kids are texting with their eyes up here, right? Nowhere their eyes. Down here, they're losing the normal curve in their neck, and now these kids are ending up with so many health issues, especially numbness and tingling in the arms and hands, stiffness in the neck, headaches are everywhere. If you have a pain in your head, you have the pain in your head for a reason. Now, we know if we eat well and we have a good attitude and we exercise and we have rest, I get it. But if you don't have life supply to the organ or the muscle or the disc of your spine, you are going to have a horrible life. Get checked before you go into this system. I've had many families say to me, Doc, I'm getting rid of my health insurance. Doc, I'm done with the system. I'm now going to be vitalistically proactive. I'm using you as my primary physician. You're my guy. Hundreds of families over the last 29 years. It works, man. Your body knows how to heal, but you don't trust it because you're in a... Look, delivering babies one floor below the one floor where they're aborting babies, I think could upset the God I serve. It's much safer to have a baby, in my opinion, at home. But you guys don't hear about my opinion because you have disease insurance. What happens to the baby on the left? Dies. What happens to the baby on the right? It lives. That's called a vacuum. You ever hear vacuum distraction technique where they shove this thing up inside a woman's birth canal and they use a hydraulic to rip the baby out? In the old days, they still do it now, forceps delivery. I've had people come to me, tell me I have forceps delivery, and I put my hands right here, and you can feel the end. Yeah, more limitation. That could be your neck. Why your neck's like that? You would deliver forceps? Yeah, because it's soft bone. You understand? It's soft. All right. Hey, how does that look to you? Now that's crazy. Why would anybody want to have a healthy nervous system? Let's wait till the kid has leukemia, then we'll bring him in every day. We'll bring him to your house. We'll come on Sundays after church. All right, we're going to finish up with a couple of x-rays. We'll call it a night. This girl is 16 years old. She has an arc in her neck. And what is the arc called? Anybody know? The C curve. It's the arc of life. Do you see this crooked neck? Everyone said? Yes. Is that healthy or unhealthy? Healthy or unhealthy? Healthy or unhealthy? Healthy or unhealthy? Healthy. Unhealthy. Healthy. Unhealthy. Healthy. This is exactly the curve you need to have. It's called the arc of life. And from the side, you look at these, you see this pelvic bone? This pelvic bone is straight. Do you see it? Okay. Now watch what happens to the pelvic bone. When I go to the side, what do I have in my spine? I've got curves. Two of you are not even going to look at x-rays. You're going to go, what the heaven happened in my neck? And I'll say it happened at birth. And you'll say, no, but I've been fine. How do you know you've been fine? All right. So what happened to the curve? Okay, so let's recap. This girl's coming in 4 times, 6 times a year for maintenance care. 99.5% of every person in this office today has been here for maintenance care except for 2 people. Only 2 people. Maintenance is the key. Crisis care, go have a needle stuck in your spine and you'll feel better. And then drink a quart of Jack Daniels, have a case of beer, and everything will be fine. You'll just be wonderful. You'll feel wonderful. All toasty and it'll be wonderful. Okay, this arc is normal. This girl goes through an emotional event in her life. Tell me what happens to her spine when she goes through an emotional event. Does she have the arc, yes or no? Okay, how many adjustments does she need this year? 4, 5, 6? 20, 30, 40, 50, 60? Who would want to come in here 60 visits a year if it's $60 an adjustment? 60 times 6 is $3,600. And that's, you know, there's a value there for that, but I'd rather make it much more affordable and have people come in for maintenance care. This is phase what? Now, if we don't take care of him in phase 1, where are we going? Phase... You guys are good. And you see the sharp pointy thing growing in the neck. There's one of you tonight that's got this pointy thing growing in the neck because you haven't taken care of your spine. You've allowed your spine to break down. Unbeknownst to you, or beknownst to you, you're just too busy. Life has got you. You got your kids, the family. Now you got a bone spur. Is that good news or bad news? And I can help you with that, but it's going to be 120 to 160 adjustments if you choose to correct your nervous system. If you say to me at night, Doc, it sounds great, I love it and everything, but you know what, man, just give me a couple adjustments, and when I can't breathe, I'll come back. That is not what we do. That is not the care that we offer. Any questions? No, we want people who really want to get on board and say, I am sick and tired of this train wreck, man, and my life is changing. All right. Oh, by the way, what comes after phase 2?
3.
Can you see the fusion of a 38-year-old young man? Fusion of his spinal cord. How many adjustments does he need? I can't accept that case for corrective care, and I get a case like that at least 3-4 times a month. We can't correct that. It's already, you see it? Any questions about how it's all fused together?
Yeah, how's it all fused together?
It's all fused together. That's how God made it, man. You abuse your body, and the body infuses calcium, because when you're a child and you get a subluxation, the vertebra loses its normal mobility. When I give a child a pediatric adjustment, I put the normal motion into that child. I'll see you in a month or 2 or 3, whatever. But when the child becomes now 8 years old, now everything changes. Progressive degeneration is what it's called. Okay? All right. So, you ever give an MRI? Now, doctors, we're done for tonight. You did a great job. The cars are pulling in from UPS and FedEx. That's why we're open late on Tuesday night. I will show you this. There's a bone in the spinal cord, and you can tell me. I don't have to tell you. So I'm going to start out up here. What's up here called? You all remember? This is the brainstem. As the vertebrae outside here are going down, there's a vertebra in the canal. Can you tell my finger where to stop? Do you see it? The vertebra is in the spinal canal. Are you ready for the last question of the night? What is this person experiencing with the vertebra in the canal, indenting into the meningeal layer of that? What is this person experiencing? Okay, what is this person experiencing? Numbness. What is this person experiencing? What is this person experiencing? What is this person experiencing? Carl, what's this person experiencing?
Yes, pain.
Carl, what's this person experiencing? What's this? That was different. What's this person experiencing? Pain. Okay. Thank you. One person got it right. I've got to go back to slide 1 now, Christian. No more filming. Guys, everyone say thank you, Michael.
Thank you, Michael.
He saved your life. This person feels fine. But the nerves to the thyroid, the nerves to the heart and lungs are shutting down, and she doesn't know it yet. Because she's only 27 years old, she doesn't know it yet. You see how you've been trained? I just spent 40 minutes teaching. How many times have I talked about pain tonight? 0. It has nothing to do with pain. It has to do with the first slide. And the first slide said what? What are we working with? The life force.
See, I said that person wouldn't be in any pain.
I am saying this person has a bone in the spinal canal experiencing interference of the life force, and there is no pain expressing itself yet. There's no tingling or numbness expressing itself yet. But believe you me, it's on the way. Well, thanks for coming tonight. I appreciate you. I hope. Now, by the way, is that neck going forward or backward? I already told you I asked the last question, so I can't ask you another question. That neck is going backwards, and we know which one we want. We want the spinal cord on the. You all can say it. It's okay. You're on video. Say it. Sound like you know what you're talking about. Left one. All right, and let's see what's happening. See the disc spaces are getting hazy between the bones. And finally, what do we got here? We got an 8-year-old on the left, a 48-year-old on the right. This is the upper neck surgical maneuver. This is a surgery in the spine, and they don't move the vertebra into its normal position because their insurance didn't pay for that. So they do the surgery to lock it, but they don't adjust it back into its place. That's why at all costs get to the chiropractor and do what he tells you to do, especially if he's not the guy that uses all the machines and sells all the stuff. Just go into a hands-on chiropractor that has a good idea of what he's doing. Who's got a question for Dr. John now that we've made it through the night? No question. Okay. See that?
I have
I'm sorry, man. It's too late. Okay.
Other than the spine that you showed where you said that's too far gone, you can't.
Phase 3, I work on phase 3 people all day long, but if they tell me they'd like to correct it, I will then share with them that they hit the point of maximum breakdown and it's not going to correct.
Okay.
So
but that's the point where you can't
correct it.
correct it anymore.
Right. My job is to apply the exact force in the exact direction with the exact intent to remove interference and to change that person's life around. Minister to them, talk to them about the Lord, remove the interference.
And you can make correction and adjustment up to that point.
If we see an analysis, we will tell you this is going to correct.
Okay.
And so, it's almost like a guarantee because I know spines, so I know that what spine will correct, and I know what spine will be a struggle. I also know personalities. I know people say, well, I'd like to do it, but I really can't afford it. When are you going to afford it? When your arms and legs don't work, or when you have to buy a wheelchair every 6 months and they're like $800? I mean, I have a thing up on my view box here of a woman came to me. She's been coming to me since she's 20. She's 35. She goes in for. She's feeling feverish, and she knew she wasn't supposed to go, but she's hanging around people that are very pro-medical. And they have her stood up on this little stool, and they're going to go ahead and they put a Q-tip. This is a few weeks ago. They go to put a Q-tip up her nose, and she passes out, falls off the table, lands on her face, breaks her nose, 2 black eyes, urinates all over herself, cracks open her face, destroys her neck. They get her back up. They clean her up. She wakes. She passed out at that moment. They charge her $188 and send it to Health Central. She spends 20 hours there, and they give her a bill for $17,341, I think it was. So, when people say it's a money issue, I know it's not a money issue. You know what it is? It's a priority issue, man. And it's a lack of, my people shall perish for lack of knowledge, Hosea said in the 4th chapter, the 6th verse. I mean, we're perishing everywhere we go. So, it's just a priority. But yes, I will work with phase 3 people, and they will get amazing results. But if I take a picture, which I do, I take a pre and a post picture for some people that request it, there won't be really a change to that structure. Although I have a guy in phase 2 just now who just looked at his pictures and he was just like blown away, man. So, I mean, you just never know. I mean, you never know, right? Good question. Okay, thanks for coming. Sign in. Listen, get your families checked. Wherever they live. We have chiropractors all over the world. But get them checked, man. They don't have to live like this. It's crazy. All right? I love you. I appreciate you. I'm glad you're here. Awesome. Good job.